Hi, my name is Christian Flutter, and let's get into some research. So today I want to take a quick moment to just talk about this wonderful paper that's come out recently. This one here, it's looking at comparisons of different methods and seeing how effective they are with children with colicky behavior. So let's have a bit of a run through it. Now the first thing I really like about this one is that it's a comparison. So you can see there's a comparison of different interventions when it comes to childhood colic. Like most papers, this one starts off by defining what colic actually is, and it defines that by saying it is excessive crying in the first few months of life. It then goes on to talk about how common colic actually is. And in this paper, it's stating that it affects somewhere between 3 and 40% of infants worldwide. Now this isn't very fun because 3 to 40%, that's a lot of babies. And there can be a lot of different reasons for this happening. In this paper, it talks about things from discomfort, benign disorders, all the way through to life-threatening illness. The key thing, however, is it also talks about average durations, how the duration of crying typically presents. And in children under 6 weeks of age, typical cry duration was seen to be between 117 and 133 minutes, and this reduces to an average of 68 minutes per day by 10 to 12 weeks of age. Now this is important, so let's keep an eye on this one, keep this one in the memory banks because we'll come back to it very shortly. Then this raises the question as to why is colic actually so important? Well, we can see in this paper they actually state 2 very, very important reasons. The first one, the consequence of having an excessively crying infant in the family are harmful to relationships and health. The second part of this same paragraph, excessive infant crying is associated with maternal issues such as depression, anxiety, and loss of parenting confidence. But if we go into the discussion, we can actually see the outcome of this analysis. It tells us the meta-analyzed results showed that both probiotics in breastfed infants and manual therapy can reduce crying time. It goes on to keep on saying the daily reduction in crying is between 33 and 76 minutes with manual therapy and 25 and 65 with probiotics in breastfed infants. Now remember how we were talking about the durations of length of time of average crying duration in infants? This is where this comes into play. If you've got an average crying time of 117 to 135 minutes and you can reduce that by between 33 to 76 minutes, that may have a profound effect. But this needs further research, and that's actually something that the authors do state inside their paper to say that further research looking at the meaningfulness, the impact of this on the parents is still needed to be researched. So then we come to the juicy conclusion, and I love the conclusion inside this paper. Let's have a look at it. We found that the strongest evidence for the treatment of infantile colic was probiotics. But, and this is the bit that I love as a chiropractor, but there was favorable evidence for manual therapy indicated by crying time. So what does this paper actually mean for us? In a crux, have we considered other options when it comes to our child who's really unsettled or colicky? Probiotics may be a good option to look at, and at the same time, a trial of manual therapy may be of benefit. Hope you enjoyed this review. There'll be more to come. See you next time. Bye.